Hi everyone, so today I am going to be presenting a topic entitled flat foot. So what is flat foot? So basically flat foot is a condition where the arches of the inside of the feet flatten, allowing the entire sole of the feet to touch the ground when standing up. So basically all babies have flat feet at birth because technically the arches will be formed by the age of 6 years old. However, 2 out of 10 children still have flat feet as an adult. Moving on to the types of foot arch. So basically we have 3 types of foot arch. And the first one we have the high arch. So for the high arch, it is basically a foot with high curvature known as cavus foot. So as you can see in the picture of the footprint, only the toes and heels are visible. So the next one we have neutral or normal arch. So this is the most common and desirable foot shape. For the footprint, the foot is half filled in the middle, forming the natural structure of the foot. Last but not least, we have flat foot. So flat foot is a condition where the feet touches the ground. So this happens due to the tendons that help pull the curvature upward do not tighten. Moving on to the types of flat foot. So basically there are 2 types of flat foot, and the first one is flexible flat foot. So this is a condition where the foot has normal arch at rest condition, but the arch disappears as it comes in contact with the surface, and it usually will affect both feet simultaneously. Moving on to the rigid flat foot. So if a person has no arch when sitting or standing up, that means they have a rigid or true flat foot. So basically rigid flat foot can be present since birth, but if it develops in adults, it is called adult acquired flat foot. And adult acquired flat foot can develop in one or both feet. Now let's talk about the causes of flat foot. So basically there are many conditions that might lead to flat foot, and few of them are trauma, obesity, neuropathy, diabetes, pregnancy, tarsal coalitions, and extranavicular bone. Moving on to the symptoms of flat foot. So basically many people with flat foot don't experience pain or other problems, but certain types of flat foot can be painful, and the symptoms are leg cramps, also muscle pain including aching or fatigue in the foot or leg. Next one, we have pain in the arch or ankle or foot or outside of the foot. Next one, we have pain when walking or pain in the changes of how you walk. Last but not least, we have toe drift. So what will happen if you have fallen arches? So person with fallen arches gonna experience first thing first is knee pain. This is because fallen arches is going to cause the rotational changes in how the ankle moves, and it's going to make their way up to the knee, causing the knee pain. And other than that, the person going to experience plantar fasciitis, Achilles tendinitis, shin splints, or tibial posterior tendinopathy. Next, the diagnosis of flat foot can be made through x-rays, CT scan, ultrasound, and MRI. As for the treatment of flat foot, so basically there is no necessary treatment for flat foot that is not cause any pain. However, for the painful flat foot, the healthcare provider might suggest to have arch supports, or also called as orthotic devices. For example, is custom-made shoes. Next one, we have stretching exercises. Last but not least is physical therapy.